I think all the analysts that I have read talk about how when you talk about the long term, when you commit to people to employ them, while no matter what you say about new people coming into the workforce going to have 3, 4, 5 different jobs, when you're talking about teachers and many state employees who commit to that sort of public service for the rest of their lives, they want to know that they're going to be taken care of in retirement. But also, the health care benefits are a great part of the reason, sort of a compensation for the fact that they're not making what they could make in the private sector. I know when I was at North Carolina State University, I was there for a while. I know that there were some people that worked there that could have done much better in the private sector, but they felt that they wanted to work within the state, do something for the people of North Carolina by educating them and serving them in research ways. They felt that it was compensated by the fact they were going to have pretty good retirement benefits, not great, but pretty good, and health benefits. So I think it's going to absolutely negatively impact it. And if I can comment also on some other ways that I think the decisions that were made, that while they look pretty good on paper when you just isolate them, when you look at the big picture of that whole program. Another example of that, and I got an email from a gentleman yesterday, as a matter of fact, who was not in my party, as a matter of fact, who was concerned about the fact that he was now having to pay $51 to have his car registered, and what could I do about that? Were we legislators going to continue increasing them 23% every year from now on? It was 41 last year, 51 this year. And it gave me a great opportunity to make the point that those fees and sales taxes on labor and so forth were stacked on top of those people in the middle class and the lower income stratas, working families and so forth. So even if they got a small tax cut last time and this time, bottom line, with increases in health care costs and these additional usage fees and usage taxes, they're not really coming out any better.